me begin with a statement that may sound uncomfortable to few people, but it is essential to understand and realize. Psoriasis is not a skin disease. Interestingly, it never was. With over 25 years of Ayurveda practice, I bring extensive experience in the clinical care, education, and also the research. I have served as a principal for an Ayurveda medical college for a decade, and I have taught Ayurveda for more than 21 years. My research portfolio includes multiple publications and projects with government and private agencies. I also had a role of dean in research. I also had a core research scientist position for over 2 years in Gujarat. Additionally, I am well versed in standards such as ISO, NABH, NABL, and QCI, etc. etc. If psoriasis was only a skin problem, creams would have cured it decades ago. If injections were the answers, relapse would not be so common. And if the skin were truly the root, then why do so many patients experience joint pain, fatigue, anxiety, digestive issues, sleep disturbances, and repeated flares? So, today, I'm not here to sell you a treatment. I'm here to explain how psoriasis actually works. Most people are told three things about the psoriasis: that one, it is lifelong; two, it is autoimmune; three, it must be managed. It cannot be corrected. That framing shapes everything that follows. When someone believes the condition is lifelong, they stop asking why. Instead, they start asking how long. How long I will need medicines? How long before the next flare? How long before it spreads? This framing quietly trains the patient to accept recurrence as normal thing. But let me reframe this clearly. Lifelong doesn't mean rootless. Chronic doesn't mean irreversible. It simply means the underlying system has not yet been understood or addressed. Psoriasis is best understood as a systemic immune metabolic disorder. That means the immune system is involved, metabolism is involved, the gut is involved, stress physiology is involved, lifestyle patterns are also at most involved. The skin is not the origin, the skin is just a display screen of the condition. Just like a warning light on your car dashboard, that doesn't mean the bulb is faulty. Like that, psoriasis plaques do not mean the skin is the primary failure. They are signals, and intelligent signals should not be silenced without being understood. Many patients blame themselves, saying that I don't follow diet perfectly, I stopped medicine in between, I am stressed, maybe that's the reason my condition is flared up. But let me say this clearly: most patients did not fail treatment, but treatment failed to address the system. Suppressive therapies are designed to reduce visible inflammation, that's all. They are not designed to restore immune balance, gut integrity, metabolic rhythm, or stress adaptation. That's the reason lesions reduce and they return back. New areas appear, stronger medicines are needed over a period of time. This is not because psoriasis is aggressive. It is because the root imbalance remain active. Let me simplify this into one connected loop: gut, blood, immune system, skin, mind, sleep, back to immune system. When digestion is compromised, inflammatory signals increase. When inflammation circulates in the blood, immune reactions intensify. When immune signals are dysregulated or intensified, the skin expresses itself visibly. When skin flares, stress increases. When stress increases, sleep and metabolism are going to suffer, and the cycle reinforces itself. It's a vicious cycle. This is why treating only the skin breaks is nothing. It simply quietens one expression of the much larger conversation inside the body. Psoriasis is not scattered chaos, it is patterned imbalance. Now, when people hear the word reversal, they assume it's a magic speed or guarantees. Let me be precise. Reversal doesn't mean overnight clearance. It doesn't mean permanent immunity. It doesn't mean zero flares forever. Reversal means understanding the drivers, correcting that is correctable, reducing dependency on the suppression, improving the stability, predictability, and also the quality of life. It's a process, not the promise. And the process requires participation, not blind hope. Okay. So alone is not enough. Some people try diet changes, some try yoga, some try supplements, some try everything at once. And still, they still feel confused. Why? Because information without a structure is a noise. Psoriasis doesn't respond to random wellness tips. It responds to sequenced correction, knowing what to address first, what to support next, and what to avoid, and what to destabilize. This is where education matters more than prescription. Let me say something very important to you. If someone promises you guaranteed cure, be cautious. If someone dismisses medicine, be cautious. If someone ignores lifestyle and metabolism, be cautious. Responsible care sits in the middle, respecting the modern diagnostics, understanding systemic physiology, applying the structured root-oriented guidance. Psoriasis deserve intelligence, not extremes. If you heard today resonance, the next step is not to commitment but clarity. Understanding how psoriasis actually works changes how you make every decision that follows about diet, medicine, stress, and expectations. If you want to learn more about system behind psoriasis and how structured root cause oriented care is approached, and if you want to learn how psoriasis actually works, this knowledge alone is empowering. I thank you for watching this video. I also thank you for liking this as appreciation and for forwarding this video to needy people. Let this video help thousands of people. Ultimately, knowledge is the power. Be with me for this power. Thank you. Thank you and all.